Welcome back and thank you for staying with Bottom Line Africa. Before the COVID-19 pandemic, half of the world's population were already living with the threat of malaria. And despite promising progress since the beginning of the millennium, the parasite is fighting back. Indeed, the most recent WHO World Malaria Report shows that now is not the time to step away, with 229 million new infections and over 400,000 malaria deaths reported in 2019. The vast majority of these deaths are young children under 5 across sub-Saharan Africa. Insufficient investment in the health sector or inactions to tackle the environmental and social determinants of health is a serious obstacle to improving health outcomes in Africa, particularly considering that the continent bears the bulk of the global morbidity and mortality burden of priority diseases like malaria. Now, to help us put context to the fight against malaria in the wake of the global COVID-19 pandemic is Lillies Njanga, who is joining us via Zoom. She is the Africa Director, Zero Malaria UK, which is a government representative and a private sector player. Thank you very much for joining us here on Bottom Line Africa. I know the COVID-19 pandemic has, disrupted some of the healthcare services. Talk to us about how exactly the fight against malaria has been affected.
Yes, thank you very much. And yes, indeed, Africa bears the heaviest burden for malaria, with up to 94% of the burden, including the deaths from malaria. And the COVID-19 situation has seen a bit of a stagnation in the progress. And we have seen resurgence of cases. Just before COVID, we were at the lowest in terms of deaths reported, but we have seen a resurgence. And we risk losing the gains that we made in about the last 20 years, where we saw 2/3 of malaria cases come down. And also about 7.6 million lives saved, 1.5 billion cases averted, and a lot of progress. But COVID has affected malaria work in a lot of ways. One being the fact that a lot of people have shied away from visiting health centers because one of the symptoms for malaria is fever, which has also been one of the symptoms for COVID. So there's been a lot of people fearing to go to health facilities because of that. There's also been interruption with services. It's estimated, it had been at the start of the pandemic, it had been estimated that the deaths could double, but that has not happened, which is great. But again, we have not had a 100% delivery of services. It is estimated we've had about 90% of delivery. So we are essentially what I would call holding the line. Not much progress happening right now.
And you've mentioned the fact that there's not much progress happening now. I will allow you to explain as to why. But Africa continues to carry about 90% of the disease burden. Why is it that Africa is bearing the brunt of this disease? And why has it stagnated?
I think one is that there is the fact that malaria is much more a tropical kind of infectious disease, and Africa is in the tropics, so that goes without saying that we bear a lot of the burden. But then yet again, that's not to say that there are no countries that have eliminated. A number of countries have eliminated. In the last 20 years, we have seen about 21 countries around the globe eliminating malaria. It just means there is much more that needs to be done. It just means that more people need to be involved in the fight against malaria. It means that more resources need to go in the fight against malaria. There is progress. Let me just clarify that even if there's been slowed progress in the last, especially in this last 1 year, we still continue to see a lot of government commitment in the fight against malaria. Let me call out Kenya. While the commitment within the Commonwealth heads of government is to have malaria by 2023. We have seen Kenya actually looking to bring it down by 75%. So there is commitment, but the fact is much more needs to be done for us to get there.
We really need to re-strategize, because, you know, when you talk about there's much more that is needed to be done, awareness has been created. There's been a number of campaigns. There are champions even at the grassroots level. So do we really need to re-strategize in general?
Yes, we need to re-strategize, and I'll call one group out that has not been part of this, and these are the youth. Africa is a very youthful continent. 74%, call it 75%, is below 35 years of age. Can you imagine if we use this resource to help with the advocacy, with the communications from all their networks? I think there has been this forgotten segment of the population that can really forge forward. And it is great that right now there is that recognition and that the youth are really coming up to be part of the campaign. We have seen what we are calling the End Malaria Councils being formed across Africa. This is the engagement of the private sector and other sectors in the fight against malaria. All these are sectors that were previously not at the forefront. So there is a whole new strategy of involving other people or other sectors besides health that have not been engaged in the past. So we can see a lot of new strategies. We can see new innovations coming up for malaria.
All right. Thank you very much, Lillies Njanga, Africa Director at Malaria No More UK, for joining us to just shed some light on the fight against malaria. In Rwanda, a total of 300